Good morning, friends. Happy Friday. I am coming back to you for video number 5, which is going to focus on advice and information for our pregnant mamas out there, as well as for all of you parents. A quick update on the numbers. You may have seen yesterday was the very first day that the U.S. exceeded the number of cases in comparison to any other country in the world. That is terrifying. We now have 2,000 more cases than China does, and China has 1.4 billion people in their country, and we have 327 million. So the fact that we now have 2,000 more cases is incredibly frightening. What else terrifies me about this information is that the very first case in China was discovered in mid-November, and our first case was discovered in mid to late January. So we are 2 months behind China, and yet our numbers are exceeding them incredibly rapidly. So for those of you who still are not taking this seriously, I don't know what else will convince you. This is a major problem for our country. And again, I thank you for those who are social distancing and going above and beyond to provide help to your networks and your essential industry workers. But for those of you who don't get it, you need to open your eyes and simply look at the numbers. This is not rocket science. This is something that is going to start affecting you or your family or your friends very quickly. Okay, so in terms of pregnancy, you pregnant mamas had a lot of questions out there, so I'm going to do my best to answer as many as I can with the very little information that is available to us right now. One of your questions was, are you more at risk for coronavirus being pregnant? And interestingly, at this point in time, based on the research that is available to us, it actually doesn't seem that pregnant women are at increased risk for either contracting coronavirus or having a more severe disease with coronavirus. But what we do know is that pregnant women in general do have a compromised immune system, and they are at higher risk for more severe disease with other viruses like the flu, as well as the other coronaviruses that caused pandemics in these previous 2 decades like SARS and MERS, which were very, very aggressive in pregnant women. And so for this reason, pregnant women are considered to be an at-risk population for COVID-19, and we will get into a few extra precautions that I feel you should be taking just because we don't know the potential for this virus in a pregnant woman's body. The next question that was asked most frequently was, if I am pregnant and I get this virus, can I pass it on to my baby? And again, the answer is we don't know. In February, there was a study that came out of China of only 9 pregnant women, very, very small, and all of them had babies that were unaffected by the virus, even though they tested positive for the virus. But yesterday, there was some information that was spread quite widely through different news media outlets. And it was a study in China, again, with 33 pregnant women. And all of them had confirmed COVID-19 disease, and 3 of their babies tested positive and had symptoms. But there's a few things you have to understand about this study, and I'm going to have to get a little bit medical with you in order to explain it. All of these babies tested positive by way of antibody testing. So they had a blood draw, and specifically what was looked at in their blood was a type of antibody called IgM, and it was an IgM against coronavirus. The thing is that IgM is a very large molecule, and it can't be passed from the mom across the placenta into the baby. So if you find this in the baby's bloodstream, it means that the baby's immune system specifically made it. They didn't get it from their mom. And so if you see that, then you think, well, wow, this baby obviously did get coronavirus or was exposed to it from their mom, and then their immune system started to fight it. But in other more well-known infections that we absolutely know can pass from mom to baby over years and decades of research, IgM is not a great test to confirm that diagnosis, because there are a lot of false positives and a lot of false negatives, as well as a lot of cross-reactivity that is happening in the testing process, specifically in babies. And in general, IgM testing is not as accurate as what is being performed through the nasal swabs that we're doing right now, which is called PCR. And none of these 3 babies that supposedly contracted coronavirus from their mothers had a positive PCR test. All of their nasal swabs were actually negative. So again, this information has to be interpreted with a little bit of a grain of salt. And the other thing that was interesting in these babies was that their IgM levels fell very, very quickly. And in fact, by 1 week of life, it was completely gone from their system. Whereas in other infections that we know can be transmitted from mom to baby, and the IgM levels stay high for weeks, if not months. So this just doesn't really fully make sense. In addition, one of those babies was born at 31 weeks and had some respiratory distress, but we don't know if that respiratory distress was because the baby had immature lungs or was in fact because of coronavirus 19 or COVID-19. The other 2 were full term, but they were described to have lethargy and fever and findings consistent with pneumonia on their chest x-ray. So again, this is still an incredibly small study with lots of ifs, ands, or buts. And I just think that we really don't know that answer at this point in time. There are very large studies that are being done here in the US that I think will start to clarify this more and more as time goes on. But again, it's really important for our pregnant mamas to take the utmost precaution at this time, simply because of the unknown. And of course, first and foremost, you want to follow your doctor's recommendations and your hospital precautions. The information that I am relaying to you is based on my research and my opinions. I personally do not think that you should seek an alternate delivery site other than your hospital in light of what is going on. I know that it can be scary to know that somewhere in that hospital there has been a case of COVID-19 that has been diagnosed, whether it was in the emergency room or that person is hospitalized in that particular hospital. But I want you to think about it like this. At some point in time, coronavirus will be circulating in a high amount within the community, and you might get it or be exposed to it in the grocery store. But you have to go to the grocery store because you need food to feed yourself and your baby as well as your family. So this is an essential process of life. To me, delivering your baby in a hospital is an essential process of life. And quite honestly, that hospital is going to go far above and beyond the ability or the capacity of a grocery store to make sure that you are safe and you are not exposed to this virus simply because it has been present somewhere else. And at least for all of the hospitals that I have ever taken care of babies at, labor and delivery and postpartum are very far removed, purposefully so, from emergency rooms, ICUs, and where they are keeping very sick, hospitalized patients. And I lost track. I'm looking at my notes. And then in regards to the precautions that you are going to take on a day-to-day basis, honestly, don't let other people's opinions right now of you and how aggressive you are in taking care of your baby stop you from doing what you feel is right. This is one of these circumstances where, whether it's 3 months from now, 6 months from now, 9 months from now, when this is over and you have a healthy baby, everybody else's opinions of how you took care of that baby are going to be irrelevant. So of course, wash your hands, wash your hands, wash your hands. I don't think we've said wash your hands more in these last few weeks than we have recently, but also be sure to wash your hands immediately before you eat. Limit your outings. If you can, have somebody else do your grocery shopping for you, have somebody or have Instacart bring you your groceries. I know it gets boring just sitting at home all day, and sometimes just that one outing a day helps you. But again, as I mentioned, I do feel like coronavirus is going to be in our communities, and it's going to be in these public places. And this is a short amount of time relative to your baby's whole life that I am encouraging you to stay home. This is going to be a little controversial, but I think you need to limit your visitors as well. And I know some friends and family are not going to be happy with me saying that. But again, there is this ability for an asymptomatic person to shed the virus. And your single job right now is to protect your baby. Nobody else can do that. And while you can say, don't come over if you're sick, right now we just don't know when is that person going to get sick. Is it going to be tomorrow that they start coughing, but yet they were at your house visiting you the day before? And so I just think it's really, really important to be aggressive right now. I also think that you should limit your touches with the outside world. I do want to support our small businesses out there, but if you can avoid takeout and eating out and Starbucks and all of these types of things right now, Mama, I think it's going to give you more and more peace of mind. And if you have to work, then this is one of those circumstances where I do think that you should wear a mask that covers your mouth and your nose at all times. And the reason that I am personally so aggressive with these recommendations is because I want you to imagine the stress of testing positive right now when you're pregnant. If you think your hormones and your emotions are running high right now, imagine what it would be with a positive test. I mean, it would be overwhelming to deal with that, especially thinking about it for the weeks and the months that you have before delivering, and not knowing whether or not there's going to be a problem with your baby until you literally see your baby. It would be agonizing. And this is what I want to prevent you from having to struggle through, as well as, of course, you getting very sick or your baby getting sick. People have asked me, should I get pregnant during this time? And that's a very personal decision. So, of course, I can't make that decision for anyone. I think the things that you want to think about are, of course, these precautions that I have laid out. And if that sounds like it's too much, it's excessive, it's not something that you are remotely interested in doing above and beyond the social distancing that you're already practicing, then maybe this isn't the time to consider getting pregnant. In addition, it's important to think about the fact that you will be in doctor's offices for your routine OB visits, and you will have to go to the lab and possibly a radiology suite for your ultrasounds. These are extra touches with the outside world that might increase your exposure. And if that gives you anxiety right now, just thinking about having to do those things, maybe this isn't the right time. On the flip side, I can't tell you how long this is going to go on. And for some of you who are eager to get pregnant and start your families, I know telling you to hold off for an indefinite amount of time is also very frustrating. So like I said, I can't make that decision, but I hope that some of this information that I present to you at least can make you feel informed as you talk about that with your partner. So some more information now on newborns, babies, as well as kids with immunocompromised systems. And if you don't know if your child has a compromised immune system, definitely talk to your doctor about that. They'll be able to give you a little bit more guidance. It's a huge list. Sometimes it's not as obvious as you would think. What we know is that newborns and babies under the age of 6 months do obviously have a compromised immune system. And other viruses like the flu or RSV are incredibly dangerous for these babies. But, let me switch my page here. COVID-19 does not seem to have a strong predilection for babies and young children, including those with a compromised immune system. Now, by no means does this not mean that babies are not getting it, that it doesn't mean that children are not getting it. They absolutely are. And a very, very, very small number of them are being hospitalized and are dying from it. So it's not to say that any of our babies or our children are exempt from this, and we still need to monitor them with extreme caution. It is just a very fortuitous situation that we are in right now, that they just don't seem to be as greatly affected as individuals over the age of 65. I have looked for numbers in the United States as to what percentage of people under the age of 65 are being hospitalized. And one study said 20%, which seemed a little bit high to me. But again, I just don't think we have that information right now to give you a reliable number as to what are the percentages of who is more likely to get sick in terms of different age brackets, other than what you already know, which are those over the age of 65. Again, I want you to imagine that if your baby or your child tested positive, the type of anxiety that would create inside of you. So simply don't run the risk with your kids. Follow the precautions that I talked about before, as well as what I'm going to talk about in just a moment for toddlers and older kids. I often tell my new parents that based on the American Academy of Pediatric Standards, when a baby gets a fever over 100.4 in the first 28 days of life, it is an automatic readmission to the hospital. And unfortunately, those babies will get a blood draw. They have to have their urine checked by a bladder catheterization. They have to have a spinal tap. They have to have an IV, and they have to have antibiotics for 48 hours. And that's simply because our studies have shown us that we are not very good at appreciating when a baby is sick simply by their physical exam. And babies are not very good at showing us when they are very sick, and they can deteriorate quickly. So we always act with an abundance of caution to make sure there are no other infections happening if a baby gets a fever in those first 28 days of life. Now, you can imagine that's a traumatic process for any new parent, whether you've had several, when your newborn is in the hospital and having to undergo that. It's agonizing for the parents, and I know many of you have probably experienced it. And so I tell them it's okay to be vigilant and to be aggressive to protect your babies. If you want no one to come in the first month of life, then that's okay. And I know people might roll your eyes at you and they may say you're being a little bit too aggro, but in my opinion, right now with where we're at with so many unknowns, you cannot be too aggressive in protecting your children. And ultimately, I think that's going to protect other people because, like I've mentioned before, your children may not be affected, but they may become the vectors to spread it to other people. The last point on the young babies is please do stay up to date on their vaccines. Recently, we had a case of whooping cough, and it was in an otherwise healthy, vaccinated 4-year-old girl. So these other diseases that nobody's really paying attention to right now in light of what's happening are still present, and they are still big risks for our babies. So make sure that your young ones are getting their shots as in a timely fashion. So moving on to toddlers and older kids. First of all, parents, I want you guys to give yourself some grace. This is probably an incredibly difficult time for you guys, having all of them at home with little access to daycare and preschools and, of course, regular schools. If you are not killing it with your homeschool game, please don't worry about it. Our teachers were asked to become homeschool teachers in the drop of a hat. And you parents were asked to become homeschool parents in the drop of a hat with zero training whatsoever on either parts. So everybody is simply just doing their best, but it doesn't need to be perfect. Don't fall into that trap of comparing yourself to how much work so-and-so did or how great somebody else's projects did. Just do what you can. And if you're about to rip your hair out because you cannot get through this lesson and your child is about to rip their hair out because they don't want to look at you anymore, put it away. Give yourself some grace. Find something fun to do with them. We will figure this out. And I don't know how we're going to figure it out in terms of extra school or summer school or what they'll do next fall. I have no idea, but I know that we will figure it out. And I know that the focus right now for us parents should be to provide your kids with reassurance, to provide them with structure, to provide them with laughs and snuggles. Because although they may not completely understand what's happening, they certainly can perceive the stress that you may be experiencing. And it's important to let them know to the best of your ability that you guys are going to be okay. take advantage of this slower time when our kids are not in all of their extra activities and they're not in school, to just hang out with them and to look at them and to go find bugs on a walk with them. It's really important not to stress them out over school and not to stress you guys out over school as well, because we know that when you're stressed, your immune systems don't work nearly as well as they potentially could. And particularly, with your toddlers, they may not understand what all of this pandemic business is about. I don't even think they can really wrap their minds around so much of the abstract that is involved with everything. And don't spend too much time trying to teach them what it is. I think your efforts are better placed in terms of giving them a little bit of structure. It doesn't mean that you have to wake up right at 6:30 on the dot and get on the go like you were, but at least let them know what the first half of the day is going to look like and what the second half of the day is going to look like, so that they can sort of anticipate the days as they are coming along. And of course, do your best to keep them healthy. I touched upon this on one of my previous videos about different things you can do to keep them healthy. I agree, we are all probably snacking and eating more than we should be, myself included. My sugar intake, I don't even want to know what it is, but it's not good because I'm looking for that comfort like many of you guys are. Give yourself grace. But do try to make sure that you, as well as your kids, are drinking enough water. You're eating as much of the rainbow in terms of fruits and veggies and whatever you can get into your kids. Make sure that they're getting enough sleep. I know you may be struggling to sleep because of the anxiety that the situation provokes, but your kids really focus on getting the right amount of sleep for them. It's okay to stay up a little later and watch TV and movies with them, but they need their sleep as well. And make sure that they're getting enough playtime, whether that is inside, whether that is outside. They've got to move their bodies. And when they move their bodies is when they are easier for you guys to be able to take care of them. Somebody asked, what about outdoor play or playtime? And I think it really honestly depends on where you live. If your kiddos are able to play outside where they can be 6 feet away from other kids, then I think it's fine. If you live in a densely populated area or where there's a lot of people outside, or perhaps it's unsafe, then obviously outdoor playtime might not be the right idea, but perhaps your backyard will be okay. Or of course, if you go on walks with them and you can sort of make sure that you guys stay in your bubble with 6 feet distance from other people. I strongly discourage play dates right now, you guys. I know it's hard. I know you want to hang out with other parents. I know the kids want to see their friends, but this is really not the time. Many of you asked, what about if my spouse has an essential job and is gone, but I need to be the one going to the grocery stores to pick up food for the family, and I have to take the kids with me? My advice, if there is any way possible that you don't have to bring the kids, to try and find that. Whether that is through Target or Walmart pickup, where you just wait in the parking lot and they bring you your items, or it's through Instacart delivery, or if it is by calling backup. I know that we are obviously trying to limit our contact with other people, but I think sometimes if you are in a difficult predicament, maybe you need to see if there is someone who is relatively young, maybe under the age of 65, who has been practicing social distancing, who you trust to watch your children while you go out of the house so that you don't have to expose them. Just think a little bit out of the box, and perhaps if you are able to return that favor for someone, or to do that favor for someone, then you can return the favor for them at a different point in time. But again, if you can avoid taking your kids out when you go to the grocery stores, I do think it's worth it. But at the same time, I understand that life is life, and sometimes that's just not going to be an option, in which case you've just got to do your best. Maybe put them all in the cart with your groceries. I know it's tough right now. I'm not going to pretend that you guys are in an easy situation by any means. In terms of the park and play structures, some have asked about that. And I think that for the kids that are older, that you can trust to not put their hands in their noses and their mouths and their eyes from when they are playing at the park or in the play structure to when you go home. then it might be okay. And I'm talking about play structures that are close to your house, not that you're like packing up and driving to a park that's far away from you. If that's the case, honestly, guys, I wouldn't be doing that right now. Somebody else asked about seeing grandparents. If your kids have already been home for 14 days and they've shown no signs of illness and you've really been vigilant about keeping them in quarantine, can they then start to see your parents because they really haven't had any exposures? To me, unfortunately, the answer is still no. And the reason is because somebody in your house is still leaving to get those essential items like groceries and food. And baby, can you ask Daddy, please? I'll be done in just a few minutes, okay? And so basically, there's still exposures. You guys, sorry for the interruption. Somebody in your house is leaving to go buy those things and they may be exposed, and then they may share the virus with your kids, and then your kids are going to see their grandparents. And so unfortunately, it's not one of those situations where we can really like lock ourselves completely away from the whole world, because somebody's got to go out there to work or to buy us food, and then they come back into the house, and that could be a potential exposure. And then again, your kids can still spread it to your parents. So again, I know it's hard. I know these rules that I'm putting forth, or these recommendations, are very, very strict, and I am sorry for that, but I truly think that it is in the best interest for you pregnant mamas, for your new babies, for your children, for your parents, and for yourself. This will pass. I promise you, it will pass. And there will be more time later down the road to talk about how hard this was and how crazy it was if we all follow these rules and we all stay healthy in the process. So thank you guys for watching. I hope it was helpful, and I will see you next time.